Welcome to Medicine Master Academy, and today we will discuss what you need to know about aortic stenosis for the Step 2 CK. Let's consider this clinical scenario. A 72-year-old man presents to the clinic with a history of gradually worsening fatigue and shortness of breath, especially during exertion. He also reports episodes of dizziness and occasional chest pain. On physical examination, a harsh systolic murmur is audible at the right second intercostal space, radiating to the carotids. EKG shows left ventricular hypertrophy. An echocardiogram shows a reduced aortic valve area, and Doppler study reveals increased transvalvular gradient. This patient has aortic stenosis, and this is how the harsh systolic murmur sounds like. Aortic stenosis is a medical condition characterized by the narrowing of the opening of the aortic valve. This narrowing restricts the flow of blood from the left ventricle to the aorta, leading to increased pressure within the left ventricle. Several risk factors contribute to the development of aortic stenosis. Advanced age, hypertension, smoking, and hyperlipidemia are among the common risk factors. In developed countries, aortic stenosis primarily results from age-related calcification. However, other causes include congenital bicuspid aortic valve and rheumatic heart disease. Symptoms of aortic stenosis include shortness of breath, chest pain, dizziness or syncope, fatigue, especially during exertion. During a physical exam, the following signs may be observed: slow rising, diminished carotid pulse, also known as pulsus parvus et tardus, a harsh systolic ejection murmur, best heard at the right second intercostal space, which may radiate to the carotids. The intensity of the murmur can increase with squatting and decrease with standing and the Valsalva maneuver due to changes in venous return to the heart. Diagnosis of aortic stenosis is typically initiated with an echocardiogram, which allows direct visualization of the aortic valve. Doppler echocardiography is utilized to assess the severity of stenosis and evaluate left ventricular function. The most accurate diagnostic method is an invasive cardiac catheterization. Regarding treatment, asymptomatic patients or those with mild stenosis can be closely monitored without immediate intervention. Medications such as beta blockers, diuretics, and ACE inhibitors can assist in managing symptoms but do not alter the disease's progression. Symptomatic patients or individuals with severe stenosis require aortic valve replacement either through surgical or transcatheter approaches as the preferred treatment. Patients are advised to avoid vigorous physical activity that may trigger syncope or sudden cardiac death. And this is the high-yield content that you need to know about aortic stenosis for the Step 2 CK. Our courses and question banks will help you to gain more confidence and information.
For more information about our courses, visit our website.